Okay, so hello friends, today we will discuss about the surgical instruments. So we will discuss surgical instruments names and their uses. We will discuss a total 56 instruments. Okay, so let's start. So we will start with the surgical blades. So the uses of surgical blades are for giving incision and for removing of suture. Okay. Our next instrument is linear stapler or linear cutter. The uses are bowel anastomosis and sleep gastrectomy. Our next instrument is circular stapler. Uses for end-to-end anastomosis after bowel resection or in esophagogastric surgery. Our next instrument is needle holder. Doctor use it to hold a suturing needle for closing wounds during suturing and surgical procedures. Next instrument is needle. Used it to invade the tissue and carry the suture material during suturing process. Next we will discuss about forceps. Here we will discuss Chittle sterilizer forceps, dissecting forceps, Lent tissue holding forceps, Babcock tissue forceps, toothed forceps, Russian forceps, Burt Parker handle, artery forceps, Kocher's tissue forceps, Alice tissue forceps and Rampley sponge holder. So let's start. So this is Chittle sterilizer forceps. So it is used to remove sterilized instruments from boilers and formalin cabinet. Next, this is dissecting forceps. Use of this is other than dissecting, it is mainly used as an extension to the user's grip in holding tissue, suture and needles. Next instrument is Lent tissue holding forceps. It is used to hold tough or bulky tissues for skin apposition and for lymph node for biopsy or appendix in appendectomy. Next instrument is Babcock tissue forceps. So it is used in numerous surgical procedures, most commonly used during appendicectomy to hold either appendix or cecum. Next instrument is toothed forceps. It is used to handle tissues and different materials and used it to manipulate needles and other instruments while operating. Next instrument is Russian forceps. So it is used for traumatic tissue grasping during dissection. Next instrument is Burt Parker handle. So this is the handle and this is the blade. So you can add different blade to the handle. So to add the blade and along with the blade the whole instrument is used for precise skin incision. Okay. Next instrument is artery forceps, also known as hemostatic forceps or vascular forceps. It is used to grasp the vessel and allow ligation of those vessels. Okay, so next instrument is Kocher's tissue forceps. So it is used to grasp tough, fibrous, slippery tissues such as muscle and fascia. Next instrument is Alice tissue forceps. So it is used to hold or grasp heavy tissues. Next instrument is Rampley sponge holder. It is used for holding swabs when preparing a patient or used to grip and manipulate cervical tissue during gynecological procedures. Now we will discuss about the retractors. So we have Langenbeck retractor, Army Navy retractor, Journey retractor, Catspaw retractor, Dever retractor, single hook retractors, double hook retractor, Morris retractor, Harrington retractor, Allison lung retractor, self-retaining abdominal retractor, Finocchietto self-retaining chest wall retractor, Jols self-retaining thyroid retractor. So first one is the Langenbeck retractor. So it is used to retract soft tissues and wound edges in order to visualize deeper structure. Next is Army Navy retractor. So it is used to retract shallow or superficial incisions. Next is Journey retractor. So it is used superficial retraction of skin during laparotomy. Catspaw or Sein-Mueller retractor. It is used to retract the skin during minor operations. Dever retractor. It is used to hold the edges of an abdominal or chest incision open so that the surgeon is able to reach underlying organs. Next instrument is single hook retractor. It is used inside the vestibular skin cephali to the marginal incision. Next instrument is double hook retractor. It is used to retract the vestibule of the nose outwardly. Next is Morris retractor. It is used to retract abdominal wall incisions, loin incisions, and subcostal wounds. Next is Harrington retractor. It is used to hold back tissue and deep organs in the abdomen. Next is Allison lung retractor. It is used in cardiothoracic surgery in which it is necessary to retract the lungs. Okay. Self-retaining abdominal retractor. It is used as abdominal retractor for mini laparotomy. Next is Finocchietto's self-retaining chest wall retractor. It is used to separate ribs in thoracic surgery. Next is Jols self-retaining thyroid retractor. So it is used to retract soft tissue and enhance the visualization of the surgical field in thyroid and vaginal surgeries. Next is Veress needle. So it is used to create pneumoperitoneum for laparoscopic surgery. Next is laparoscopic trocar. So it is used to access and drain collections of fluid such as in a patient with hydrothorax or ascites. Next we will discuss about the clip. So we will discuss Doyen's cross towel clip, Moynihan tetra clip, Myers towel clip, and Liga clip. So first one is the Doyen cross towel clip. So it is used to draping towels for fixing diathermic cables, suction tubes, etc. And it also may be used to hold ribs while elevating flail segment of chest. Next is Moynihan tetratowel clip. So it is used to hold sterile towels as close the incision as possible. Next is Myers towel clip. So it is used to hold sterile towels as close the incision as possible. Next, these are the Liga clip. Okay, so these are the Liga clips, and it is kept through this instrument. So this is used as extra ligating metallic clip in both open and endoscopic surgeries. Next we will discuss about the clamps. Under this we will discuss about Lane intestinal clamp, Doyen's intestinal clamp, Bulldog arterial clamp, and Satinsky bicurved clamp. So first one is the Lane intestinal clamp. It is used to grasp and occlude large organs such as stomach and the intestine during general surgeries. Next one is the Doyne's intestinal clamp. So it is used to occlude the lumen of the intestine and the blood vessels as they are specially designed to handle delicate structure. Next one is the Bulldog arterial clamp. So it is used to stop blood flow to a particular organ of interest. Mainly it is used in coronary surgery where blood flow must be stopped. Next one is Satinsky bicurved clamp. It is specially designed to control blood flow in the vena cava vein. It is used in a variety of cardiovascular and cardiothoracic surgery. Next is SILS port. SILS port. It is used to enable laparoscopic surgery through a single incision. Next is periosteal elevator. It is used to leave full thickness of tissue flaps. Next is Humby knife. It is used to produce thin slices of skin from a donor area in order to use them for making skin grafts, mainly used in grade 3 burns or trauma. Next is electric dermatome. So it is also used to produce thin slices of skin from a donor area in order to use them for making skin grafts, mainly used in grade 3 burns or trauma. Electric dermatomes are better for cutting out thinner and longer strips of skin with a more homogeneous thickness. Next, these are surgical scissors. So these are used for cutting organs, dissecting tissues, removing abnormal or diseased tissues, cutting and removing bandages, casts, clothing and sutures. Next, this is speculum. So vaginal speculum is used to dilate the vagina for examination of vagina and cervix. Okay, so next instrument is suction tube. So it is inserted into the upper airway to drain the mucus, saliva and other debris that obstructs a person's breathing. Next is surgical hook. It is used to grasp, move and sometimes remove various types of tissues or objects like an IUD. Next, this is surgical mesh. It is used to provide support prolapsed organs either temporarily or permanently. Okay, so next one is the curettes. So it is used for scraping or debriding biological tissue or debris in a biopsy, excision or cleaning procedures. Next one is tongue depressor. So it is used to depress the tongue to allow the examination of the mouth and throat. Next one is the towel clamp. So it is used for grasping tissue, securing towels and holding or reducing small bone fractures. Next one is the cannula. It is inserted into the vein for obtaining blood samples and for administering of medicines. Next one, this is cautery. Generally, it is heated to a dull red glow that a physician applies to produce blisters to stop bleeding of a blood vessel and for other similar purposes. Next is articulator. It is used to diagnose the state of occlusion in both the natural and artificial dentition. Thank you. So guys, if you like this video, then please do not forget to hit the like button and please do subscribe my channel.